This is Dr. Steve with Rockwall CPR and What a Save. What I'd like to go over today is Narcan or naloxone, the nasal spray you would use in case of an opioid overdose. Now, this is the actual prescribing information insert that will be in the naloxone package. So this should be the most accurate information you can get about naloxone. So let's go over this. At the top on the front page is indications and use. It is an opioid antagonist, so it works against the opioid to help restore breathing. It's indicated for emergency treatment of known or suspected opioid overdose, as manifested by respiratory and or central nervous system depression, meaning it messes up your breathing. It's intended for immediate administration as emergency therapy in settings where opioids may be present. It's a nasal spray for intranasal use only. Seek emergency medical care after use, as in call 911. You administer a single spray of Narcan to adults or pediatric patients through the nostril, one nostril. It's a single dose administration. So let's keep going here. Here's what's in the packet, the information that's in the packet. So let's scroll down. Indications and use. Suspected opioid overdose, as we just discussed. It's an intranasal spray. That's the way it's supposed to be used. Now, let's scroll down here. You put the patient in the supine position. Supine just means on your back, on their back. Prior to administration, be sure the device nozzle is inserted into either nostril of the patient and provide support to the back of the neck to allow the head to tilt back. Do not prime or test the device prior to the administration, meaning stick it in the person's nostril and push the device plunger. Remove the device after you push the plunger, call 911, and if necessary, if the person's unresponsive, you will be starting CPR. So go through this, learn about Narcan, learn when to use it. You're using it for depression of respiration, so the person's breathing is not going to be normal. It can either be non-existent, it can be agonal breathing, which is basically breathing all over the place. It's not going to sound even close to normal. The pupils will be constricted, meaning very, very narrowed, and the person can be cyanotic or a little bit bluish. These are the warning signs that something is spiraling out of control. What does the Narcan do? It replaces the opioid on the opioid receptor, meaning it doesn't allow the opioid to attach to the opioid receptor. So it basically gives you a window of opportunity where breathing will be somewhat restored, maybe fully restored, but at least somewhat restored, and it gives you that window of opportunity to call 911 and rescue this victim. Learn more, contact us, rockwallcpr.com.